Dentistry, in my opinion, again, is one of those careers that will slap you down if you get a little bit too cocky.
Hmm.
You can't be too humble, because in that you can give yourself a hard time.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Laurence Doan, and today we're joined by Dr Kristina Cain. She graduated from the University of Queensland and has practiced in Cairns, Sydney, Melbourne and Brisbane over the past 25 years. She has been a busy business owner for 10 years and currently operates out of Refresh Dental Spa in association with Dr. Nick Sheptooha Dental. Her main professional interests are in general family dental, cosmetic dentistry, TMJ treatments, and facial injectables for therapeutic as well as cosmetic purposes. She has a fellowship in the International Academy of Dento-facial Esthetics based in New York and is a member of the ADA in Brisbane Dental Study Club. She's a consultant for the Dental Advisory Panel for Experien and has a mentoring role with the ADA and is a qualified GP. Dr. Kristina Cain, welcome to the show.
Thanks, Laura. Thank you for having me.
So tell us about your CPD or dental journey into developing a special interest for cosmetic enhancements, implantology, crown bridge, and ortho and facial aesthetics.
Well, it's been happening now for 25 years, Laurence. So I'm not going to tell you every single year and all of the CPD I've encountered. I'll break it down into 3 parts. I think that's going to be a little bit kinder for your audience. I can't believe 25 years has gone that fast, to be honest. And actually, before I start, I just want to commend you with everybody for what you've been doing with such enthusiasm and bringing such quality to our profession and helping everyone get enthusiastic about CPD again. So thank you. Well done. So if you can picture this, I've got my first years of graduation, the middle years of really building the career, and then the last sort of 10 years or so of owning a business. So the first years, if you can picture a 23-year-old like we've all been, finishing up and just leaving and going to far north Queensland where I knew absolutely no one, and working for 2 very dynamic employers. They were both women and they immediately got me into CPD. And we didn't even call it CPD back then. It was courses, it was knowledge, it was just trying to keep you engaged with education. So I was really, really lucky, and I owe a lot to them. So they got me into a study club straight away. And of course they threw me into one of the roles, like I was the secretary straight away. And so that was quite funny, an interesting experience. So we had regular study club meetups. When we had conferences in Cairns, they nominated me, their little sidekick, to be one of the introducing speakers for these wonderful presenters, which again was very enlightening and excellent experience. And they also paid for me to come back to Brisbane to do some ceramics training too. So that was a long time ago, and they exposed me to people like Jeff Knight and Derry Rogers, and these are quite older names now, or more mature names, but we're very much, fundamental CPD people, and they were very inspiring. So that was my first, let's say, whet my appetite. The next phase was really in the guts of building that dental career. And I came back to Brisbane and worked a couple of jobs. I really have to say that your employers really are great mentors. If you can engage your employers to be mentors, most employers will actually rise to that challenge. And the gold you can get from these people with years of experience, it's worth it. It's phenomenal. So I was lucky enough to, and as you said, you've got a couple of jobs, you've got a couple of employers, and you sort of glean all this information from them. It's very much like pulling in a whole heap of balloons. So you've got your package of balloons of all your knowledge. So I found that the more I learned, the more I felt I didn't learn, if that makes sense.
Yeah.
I felt like I needed to continue to expand my knowledge. If I didn't, I just didn't feel like I was honouring my profession and keeping up to date. And that's when I sort of became a course junkie. So I love that you call yourselves CPD junkies, because all my friends and colleagues will testify to the fact that I've always said I'm a course junkie. There's no way around it. I could spend my life doing courses.
Yeah.
So in that process, I sought out courses, and there was no mandate to record what you'd done. For me, I went with what I felt I could grow on, things that I hadn't really done before. And I listened to people like Geraldine Moses, who most people have heard of in pharmacology. Mm-hmm. She really enlightened me to the concept of mixing complementary medicines with alpha medicine, and, you know, the effects that can have both negative and positive. I did a year of psychology at uni. I actually said, right, I'm just going to, I really want to learn some good communication. And in that time, there was a lot of drive to, you know, get in there and start doing your porcelain veneers. So fortunately, from the original ceramics courses I attended, I could sort of embellish on that. So I started attending the DSD courses, Christian Coachman, Tony Rotondo, people like that. So in the guts of it, it was a huge growth. And I was very much in the practical, getting to know how to look after patients, get the rapport going. You know, it's a huge learning curve for everybody. And I don't think anyone can avoid it. There's no quick fix to get to a point of experience. What do they say? It's like you can intellectualize things, know things, hear things, learn things, but until you've actually experienced it, you haven't really got that high quality to offer. So I want everyone to remember, to experience things is great. It's essential. So that's just, a little thing I really wanted to share with you. And from my experience, it's about immersing yourself and feeling like a doofus every now and then.
Well, I mean,
bring it on.
So would you say that the early practices that you're at were very much like cosmetic based? Is that what you're saying? So that's why you were doing a lot of these early courses in porcelain and veneers and all that sort?
No, I would say that they were very much general dentistry oriented. There was a lot of drill and fill, but it was more the patients were starting to ask more.
Right.
And I also experienced it when I was young. I got hit by a hockey stick. And so, of course, my 1-1 was pretty much shattered. I had a veneer put on as a kid. Well, actually, it was a composite build-up with a pin. It was lovely. And then, when I was 16, I got the veneer put on. And I guess I was always conscious of anteriors then. So it was a combination of my own knowledge and experience, patients wanting more, and my drive to learn more, as well as just being exposed to it. But these guys I worked for, so I've worked for men and women, they taught me a lot of things on that very fundamental level. Like, say a patient comes in and as a dentist you feel super guilty for their problem. And I mean, a lot of people do feel this. They're trying to fix the problems and have a lot of guilt. In the end, you have to say to the patient, well, it goes back to the size of the original hole, which I did not put there. You don't say that. And you might say, look, the tooth hasn't responded to that treatment. So I learned a lot of those kind of fundamental phrases which help you as a dentist. But the CPD all comes back to my own drive to learn more and to be able to offer more to patients.
Right. So you were saying that mainly because your patients were asking for it for you, and then you felt like, you needed to grow a bit more experience in it and knowledge on it. So that's why you started approaching more of the CPD. But in conjunction to that, it was the applying of it to make it more applicable, because you could learn all you want, but if you don't really use it, then it's not really of much use.
Yes, that is exactly right. You do have to apply it as soon as you can, and to be brave, just to get in there and to start to do it.
Right.
It's really important.
Did you work at a government clinic at one point?
I did. How did you know that?
You're Kristina Cain. I need to know these things.
Yes, I did for 6 months. And that was when I had 2 part-time jobs in private practice as well. And I felt it was essential that I spend some time in the government. And I guess it was a wonderful experience as well. I had a dentist, an older dentist in the petition next door to me. And I'll never forget hearing him say to the patient, just cut it out. Because the patient was clearly in distress. And I just went, oh my God. I would never talk, and that also cemented to me how important it is to get a rapport with your patient, have them in a very calm, accepting space so that they trust you and you can do anything to them then. But 6 months was, I limited it because I did find it a little bit disheartening, to be honest, Laurence.
Yeah.
For the sake that you just, it's the waiting lists. Back then, at least, I believe there'll always be waiting lists for the government. But, you'd see someone have a small bit of decay, but you weren't allowed to touch them because that was in the clinic, which wasn't for that. It was a perio clinic. And then it would become root canal. And then they're on such a long waiting list, it would become an extraction. And I did as much as I could. I got in trouble for a few things, just getting things done, but it was a bit disheartening. I went, right, I've done my best here and I'm going to go forth and do my best out in private.
Yeah, I mean, government jobs, I've done it in the past as well, and it's,
have you?
Yeah, I have earlier on as well. Back when I was graduating in Adelaide, I was the house dentist there at one point. And like yourself, you do find that limitations in terms of what you can do, and then you see patients that have come back off the wait list, and then you've seen the problems that might have been small initially have grown out to be a lot bigger, like you've said. Yeah,
exactly.
It does become, like you said, disheartening.
It does. But anyway, all we can do is just keep being our best, doing our best. And I mean, ethically, in the end, it was all about being in such a privileged position to be able to help that person at that time.
Exactly. Yeah, I think there is a space for government hospital clinics as well. So
Yes. Yes.
Yeah.
Anyway, yes, I wanted to share one interesting thing with you.
Yes.
About my CPD journey, and this may be good for the younger colleagues of mine to sort of know and prepare for. So when you do actually start having a family, as a female, I have to say, you have a bit of time off, and it's important because family is everything, right? And you can sort of lose a little bit of grip on your career, and it's and this goes for the guys too who are taking time off to support their partners. And it's really important to keep up, your CPD acquisition through those phases. And if you're spending more time at home, it's a great opportunity to do little things. For example, I did a laser course, Laurie Walsh's laser course, way back when I was having my children. I did an OPG course, the JP qualifying course outside of dentistry. And I think I just wanted to sort of say that was a big, significant time in my life where I didn't want to be a pretend dentist because I wasn't there all the time.
Mm-hmm.
And then once that phase finishes, you can just fully immerse yourself back in your career and still wear all those hats.
Right, yeah. Well, I mean, look, I was going to ask you at some point that for more than 50% of the demographics in dentistry, in my demographics in dentistry, are female. And as a clinician, they all reach a point where they start to contemplate practice ownership, being a specialist or being a super GP, or like you've said, starting a family, And you've shared a little bit on that, but what are your thoughts on all the other aspects?
Well, I guess in terms of when you're thinking about buying a business, it is really important to look at your capital for a start. Where is the money coming from? So if you can already start working towards accruing money involving a financial advisor, I mean, obviously COVID's COVID, so let's just put that on the shelf there and just say, look, if you can get your finances sorted, be enthusiastic about your CPD and listen to mentors, be inspired by people, and then just make calm decisions from a place of equilibrium. Don't get caught up in FOMO and rushing out there and seeing everything on social media and these people have got this, and this, it's perfect life. I believe in social media. I believe everyone needs to be on social media, not just for their own exposure, but for education. But just to be careful not to look at the perfect pictures and say, yes, that's how I have to be now, and not get yourself in that position where you're taking on things that are too hard. So back to business, it is important to do some business courses. We don't get taught those at university.
Yeah.
And I really think if you can find a good mentor and find good business courses, even outside of dentistry, just to broaden your mind and realize what platforms you can operate from. And also the practice management systems. There's quite a few around. I went through Prime all those years ago, and I learned so much from Prime. I had a wonderful coach called Maya Carson, and obviously all the crew at Prime were wonderful at that time. And I got to a point where I knew I was fine on my own. So that's something else I'll mention, is that, once you've done courses that you definitely know are valuable, it's good to sort of move on and to take what you've learned from that course and see what else is out there. There's always something new.
Well, are you saying that, if you're thinking about these things, definitely pair yourself up with someone who's gone through that road where you want to go down. But in addition to that, do CPD on business, CPD, to kind of see if that's where you want to go down before you decide to take the leap, or take the leap first and then couple yourself up with all of that.
That's I like that question. I think if you can get yourself as much knowledge as possible before you take the leap, there's no hard and fast rules on this.
Of course.
Definitely good to be, linked up with someone who can guide you. When I was I bought a second practice and merged the two together. That's why you said Refresh Dental Spa in association with. And I had Dave Moffat help me out with that transition. So I found a coach who had knowledge in the dental industry, and also a viewpoint from an older male practitioner who'd owned his own businesses. So he helped me with that transition. So I think if you can just be a little bit smart, look at who is out there and who would be strategically aligned to help you as an individual. See if you've got some good rapport with them. Reach out. Most mentors out there are keen to just chat and get to know you to see if it will work. So on a business level, look, again, you can ask mentors what business courses are out there, or just have a bit of a look around yourself and you do your due diligence on what courses are suitable, because there are a lot of startups out there that like to use us as guinea pigs. And they take our money really quickly, but in the end, we're actually giving them more than they are giving us. So I think it's good to be mindful as well. Okay, so in answer to your question, after all of that, I would say, definitely have a plan, set about your plan, knowing you've got some capital or how you're going to raise your capital, and have a mentor in the wings. Go for it, but keep educating yourself.
Yeah. Educating yourself in both like CPD in terms of clinically and business, is that what you're saying?
Yes, and also personal development. So after I'd been in the business for a while, I actually realized that my CPD had gone off on a fork. So I had the continued professional knowledge development, dentistry, facial injectables, all of that good, solid gold clinical stuff that we love. And then I also had this journey of personal development, learning a bit more about communication, learning about business application, self-empowerment. And in the midst of all that, it was always that reminder to look after your own health and what you value, and not be in a mad rush to achieve everything in a short amount of time. It's like we are innately nerds, aren't we? And I don't know about you, Laurence. I embrace that. I embrace the nerd.
Yes.
And we enjoy learning. Do you enjoy learning? You've set this up.
That's right. Yes.
That's right.
I'm a CPD junkie myself.
Yes, what do you enjoy learning about?
Well, I mean, look, I started the King's college program over in London off on PROS because that was an area that I was interested in. So,
Yes.
I felt that I wanted to explore that more, and I wanted a structured course, and that's why I did it.
Perfect. I did see that. I did my research on you too. Yes, so it's sort of like I think you've got to remember that if you enjoy learning, really immerse yourself in the enjoyment of the journey, because it's really enriching. And that's what gives you the longevity in our career, in my opinion, is keeping on enriching the journey. You have to be active in finding the enthusiasm, finding the CPD that gives you that push to keep you going, because it is very much a journey. And dentistry, in my opinion, again, is one of those careers that will slap you down if you get a little bit too cocky.
Mm-hmm.
You can't be too humble, because in that you can give yourself a hard time. And dentists are very clever people with lots of amazing skills. So it's about finding that little bit of balance. Keep yourself interested, keep yourself motivated, and look for inspiring people. And watch CPD Junkie, because you learn a lot.
So I want to come back. So you're basically you're moving from Cairns. You come into Brisbane, and then this is where you're starting to grow clinically, but also business wise. I mean, how do you find the time, and you're starting a family as well, and how do you find the time to incorporate all your other CPDs? For cosmetic or implants and ortho and facial aesthetics. How did you come across these things?
Okay, so when you went through uni, did you draw up like a timetable for your studying when you're going through exams, etc.?
Yeah, to a short degree. Yeah, it'd be like I want to prepare for this because this is the first exam, and then I might rehash it back closer to the exam period. Yeah.
Yes. So in a sense, I set up, once I had children in Cairns, it was very cruisy, laid back up there. My employer at the time, Alan Ritchie's, let me just work 1 day a week. I kept my hand in, kept my skills in. But I guess for those first 5 years, I wasn't pushing my career. I was very much enjoying the family aspect, maintaining my energy levels, and just keeping my hand in, as well as doing my CPD. Now, that was not as full on as it is, obviously, when you're not looking after babies, but it was enough to keep me intellectually stimulated. Once your children can go to daycare or have a carer, depending on what suits the family, it does open the door up a little bit more for you. It's not, you're not stuck in the trenches, so to speak.
Right.
And if you can allocate a certain amount of time, like picture your week as a timetable, and there are certain times that are just no-go zones. Have you heard that analogy of having a vase and filling it up with big stones and then completing the fill with lots of little pebbles? Have you heard that?
No, I haven't. No. Yeah. Tell me more.
It's an analogy whereby it's like filling up your week with a timetable. No pressure. You've got to make sure you're not stressed about this. This is just a good way to take control of organizing your life, and you've got to have some flexibility too. It's survival of the fittest, being adaptable. So if you picture filling up your vase or your week with big items that are non-negotiable, clinical hours, time with the family, time that you have to exercise, keeping your health in order, things like that. These are non-negotiable times. And then you can drop in the pebbles to fill it in. So you might have a bit of time here or there to listen to a recorded ADA webinar, but it has to be at the right time of day, because after a certain time, say 7:30, 8 o'clock, you might be a zombie. So that's how I did it. I really looked at my week, put in my non-negotiables, and then filled in my pebbles. And the pebbles are flexible. Right. And if you get too overwhelmed, just stop. You're not stuck in a hamster wheel. You have control over your life, and it's I think self-awareness and personal auditing is important, where you sit and go, right, this is my R&R time. How are things going? Check in with yourself.
So then how did you stumble deciding on, whether to divulge into ortho or into facial aesthetics and cosmetic injectables?
I will tell you a little bit of a secret, which now everybody will know. I was 38 at the time, and the clinic I worked for was full of women, very dynamic clinic, and everyone was trying a bit of Botox. And I thought, right, I'm 38, I've had 2 kids, I think I can do that. Anyway, still a controversial time back then, you know, it's like, I was lying there getting these injectables done on the quiet, and I thought, I could do this. This is so straightforward. It's a medical anatomy, all of those things. Injectables, hey, how good are we at injections? And so I immediately started looking up, you know, that was when a lot of Facebook ads would just pop up, and it literally came up that week, Botox for dentists. So that was the ADFA course, actually. So that was back in 2011. And I was one of the first group of 12 to ever do the course. And obviously there was a lot of question about whether or not it was appropriate within our scope, all of those things around those times. So it was an interesting journey, but I did enjoy it, Laurence. And I think that was what cemented the ongoing journey of learning about injectables. It was so enjoyable. People came in so positive because they were going to get an effect that made them feel good about themselves. And to have someone say, yes, please stick needles in my face, it's pretty rare.
Yes.
On the nerd level, I loved the rekindling of all the anatomy, of all the pharmacology, biochemistry that went with it. And then it was about the aesthetics. And there's a book I've read before and have recently been reminded of called Psycho-Cybernetics. I don't know if you've heard of it, but it was written by a plastic surgeon who really identified that an improvement in someone's self-image will in fact help them on their progression to good health. And the facial injectables for me was a little bit of an avenue where I could help people with their self-image. It wasn't about vanity. It was very much about making them feel better about themselves. So that was that journey.
Yeah.
Orthodontics. I loved orthodontics. That was probably my best subject at uni as an undergrad. And I did actually get into Melbourne, but at that time in my life, I was also transitioning whether or not I was going to go overseas, moving in with my boyfriend, who was soon to become my fiance and then husband. And I just went, I'm not really ready to do another massive course. So that was fine. You have to look at those crossroads in your life and work out where you want to be. I have done a bit of ortho. I've done my quick straight teeth, Shaw, Smile. Invisalign has always been on the cards. I've just kept myself busy with other things. So yeah, I've never taken it up a notch there, but always admired my colleagues who have done so and have some very good orthodontic friends.
Fair enough. And so back quickly on the injectable side of things, you went on to become a fellow in the International Academy of Dental-facial Aesthetics. So tell us a little bit about that.
So courtesy, again, of going through the ADFA courses, which I did become a trainer with them, and I really learnt lots. And that's when I realised I love teaching as well. I love educating and inspiring. And I finished up with them in about 2017. And during that time as well, they did offer an avenue to obtain this fellowship with the International Academy of Dento-facial Aesthetics, spelt with an E. The aesthetics, and that was in New York. So we had to apply, and I went through with a few other friends, colleagues, and we had to basically tick the boxes. So they weren't accepting just anyone, and which I don't think would have sat well anyway if it was just, you know, a piece of paper. You had to have shown your journey, what you have achieved and what you're still working on. And then with acceptance from the academy, we travelled over to New York. Can't wait to go again. And it was an amazing experience with people from all over the world coming to be part of this academy. And the bonus for me is that we still have that ongoing CPD from them. So we're still linked up with them at all times, and we get our newsletters, and we can obtain more information by contacting some of the members who are incredibly dynamic. I remember one dentist was the dentist for the king in Saudi Arabia. I mean, stuff that's, it sounds like it's out of a movie, but amazing. And it doesn't hurt to have New York on your business card. Hey,
fair enough.
It's not fake, but it's a real conversation opener or starter. And and it inspires others to do the same.
A lot of recent graduates and guests that we've had on in the past, they talk about getting into cosmetics and injectables. However, they find it difficult to kind of implement it or see how it's beneficial or useful to them. Can you share your thoughts on that?
Absolutely. So if you're not a business owner, I do think it is a little bit harder. You really need to have your employer on the same page, or to at least expose them so that they're in an enthusiastic position to support you. In that case, then obviously your employer will head down the road of finding out, where to get the materials from. And usually whoever does the training for you will give you that information as well. Allergan now are very good with supplying dentists with Botox. That's the brand name, by the way. And Clifford Hallam, I believe, is still supplying the Dysport as well. So it's kind of, you have to make sure your employer and the practice you're in is going to be supportive. If you are already on doing your own thing, you have your business, or you're supported and are contracting and your employer's happy with that, I think if you just remember to keep reaching out to those of us who've been doing it for quite a long time, be it on any of the social media platforms. And there's quite a few of us all around who are always happy to talk about cases and, just offer support and advice. The benefits, oh gosh, I get very passionate about this, Laurence. How long do you have?
We've got time.
Okay. The benefits, let's say for the patient, because ethically and ultimately that is what we're looking at. And for them, there is an improvement in self-image, self-worth, how they can proceed in their day-to-day lives, feeling good about themselves and passing that along to the community and to people they're trying to help. And when I say that, what I mean is they don't have to look plastic, they don't have to look weird. You can correct facial asymmetries, you can reduce hypertrophic masseter. You can just have older people middle-aged like myself, who just sort of need a little bit of a, I want to say zhuzh, it's a bit cliche, but that literally is what they need. And then they freshen themselves up a bit and they go, oh good, I've still got it. It's very much about skin health as well. So framing your work as a dentist is so rewarding. If you do a lovely cosmetic set of veneers or some crown and bridge or some ortho, and you can enhance, say, their gummy smile, giving them a little bit of Botox in their LSAD muscles, reducing a few smokers' lines, doing a bit of work around the orbicularis oris, reducing the pull down the sad face by injecting in the DAO, little things like that can really enhance your work. So you feel good as a dentist and your patient just goes, wow. These little things can also be thrown in. You don't have to charge that person for that treatment. You can say, okay, you've just spent 10, 15 grand with me. Let me give you a little bit of Botox if you want. And see how you go. It can be a nice little add-on, value adding.
Fair enough. Yeah.
Yeah. Ask me something else.
I mean, look, hey, we talked about the veneers and stuff like that. A lot of graduates, they think that, I graduated, I've done a few crown preps here and there, but, I think I should be comfortable doing all these veneers. But what compelled you to kind of do more of that, or, crown and bridge work? And how do we, improve on that as well?
I think what encouraged me was just knowing I wanted patients to get a little bit more bang for their buck. And for me, I felt like, as long as it's conservative treatment, I think you've always got to be mindful of the conservation of enamel, conservation of tooth structure. It is paramount if you want to prevent future problems. One of my older colleagues recently said to me, we're really only supposed to have teeth for 30 years. So anything over that is a bonus. That's just based on our, evolution, our genetics. It's almost like it would be good if we could have shark teeth come through and have that next lot, but no, we can't. So restoratively, I really think crown and bridge is it's amazing, the technology now. You've got your CEREC restorations, you've got your excellent labs with excellent ceramics, implants. Clearly, technology is always advancing. So if we don't offer these solutions to our patients, then we are actually basically doing supervised neglect. So from my point of view, I love the result. I love the bang for the buck that people get with the porcelain, where you don't have your stains, you don't have your chipping. Clearly, if they are grinders, bruxes, etc., you do need to protect them as well with your splints, perhaps doing some Botox to take out the power of those masseters temporalis. And to continue learning in that field, I think just keep being aware of what is out there. Thank you, Laurence. Thank you for all the people who are putting up courses, and know which ones are reputable. The DSD ones, I think, are invaluable just for the learning of how great photography is. I see you like your photography too, Laurence. That's right.
Yeah, I mean, yeah, I'm trying to get documentation's a key part of my learning journey. Yes.
Yes. And it's not just about having like a resume to say, look at what I've done. It's because, you know, when patients see photos, they respond so much better to having a mirror put up than having a mirror, I should say, put up in front of their faces. And then they just go, and they look at everything. They don't see what you've just achieved for them. So photography is essential. And courses like DSD remind you about how you look at proportions, you look at how you can make that person smile better. And in the end, if everyone's smiling more and they've got good, healthy, dentally fit restorations, dentally fit oral cavities, it's going to take the emotional burdens away as well. I guess that's my main motivation. But with courses, yeah, you just have to keep your eyes open, keep your ears open, and listen to what people are doing, what people are saying, but not get that pressure that you're going to be on that journey of FOMO. You need to bring it back down a notch. Do your due diligence, know that it's going to cost you a bit of money for a solid course, and forge ahead, apply it straight away if you can. It's scary, but that's the only way forward.
Have you started your journey into implantology as well?
I love implant restorations. I have done an implant course. That was through Aiden and Dr. Sadi, wonderful man. And my personal feeling was I enjoyed the surgery at that stage, but I actually prefer the restorations. I decided that I could, yes, another fork in the road, I could go and do more of the surgical training. And I've got wonderful specialists in my building, and we work together. It's a bit of that, I guess, want of a better word, that holistic approach. So I embrace the restorative element, and I still love it. So I'm actually at that point. My little journey at the moment is using my CEREC machine, and my prime scan is teaching myself how to do more with that, and scanning of implants, all of that, catching up for the restoration element.
Yeah,
so that's where I'm at.
Well, digital dentistry is something that's kind of on the up and coming. There wasn't a lot of that CPD kind of floating around. So how have you kind of immersed yourself in learning more of the CEREC? Have you attended courses for that as well? Or?
Yes, and I tend to be, I think it's important to work out what style of learning you have, what resonates with you. I'm very much a one-on-one person. I love being face-to-face. So COVID's made that a little bit tricky, and so in the times that I've had my opportunities, I've had my dental reps, the ones who are highly educated, of course, and knowledgeable, talking face-to-face with them, sitting with the machine, doing the applications. My husband's gotten to be a bit of a guinea pig, lucky man, taking advantage of those opportunities. And then obviously frosting on the cake, doing your CPD courses online and following through on that. Fortunately, I've done a little bit of KOL work with Dentsply Sirona, so they have been immensely helpful as well. A little bit like, I've helped them, they'll help me as well, and helping guide me through that journey. It's been a VIP stuff. I really appreciated that. For those of you out there trying to learn, I think just look at what the courses are online, listen again to people like yourself who have a little bit more scope. You can talk, people as well, and embrace it however it comes to you. and just keep getting it all together. I think you've got to try things as you learn as well.
Yeah. You got to give it a shot before you say it's not something that you want to get into.
Absolutely. I mean, we're all like babies, aren't we? We're trying different things. Sometimes we don't like them. Have a little tanty. You can't give yourself too hard a time. We're only human.
So of all those CPDs, what's been your biggest game changer for your dentistry today?
I have to say my injectables.
Yeah.
And this is, for me, it has been a game changer, both personally for my enthusiasm in my industry, for motivating me to learn, for being able to offer something to my patients. The therapy side of things, for people with TMD, it has been huge. And I've got a lovely network of maxillofacial surgeons, head and neck physiotherapists and prosthodontists. And as this network, we've been able to help so many people who've come in so stressed, clenching, hypertrophic masseters, some with degenerative joint conditions, and find a solution or something to break that cycle, because it is a compounding kind of cycle and it's relevant. So the injectables have led me into so many avenues. Even being on the dental panel for Experien, the insurers, that the role of that is to, help my colleagues when they're having those issues and they're contacting their insurance provider, just to talk to another dentist, just someone who actually knows what it's like to walk the walk, and not just an insurance person who doesn't really know or appreciate what is going on. And because of doing the injectables, that's how I had that avenue open up for me to get on that board. And it has, that would have to be my biggest breakthrough.
Right. Yeah. So, I mean, whilst we're on that, you're a consultant for a dental legal consultant advisor. And so what kind of inspired you to become that? And has there been any particular struggles in your journey yourself?
Well, what inspired me was, I was probably just nominated, and I thought, yes, I can do that. There was an element of me that was a bit scared, thinking, oh, have I got enough knowledge? And then once I started, I realized that I did have the knowledge. And if I found myself a little bit stuck, I could always ask some other colleagues what their opinion would be. Obviously, it's a confidential kind of situation. It's very much one-on-one. There's a lot of trust involved. So being respectful of that is paramount. I've learned to be an absolute vault. The benefits have been, I can't tell you. I mean, there's something about helping others, helping your colleagues to find their way through, a situation that's quite hard to navigate. It stresses them out. It's the kind of thing where you're going to bed at night and you can't sleep. So it then affects your relationships, it affects your functioning. And this is quite serious. And if you can talk to someone, and someone who actually understands and recognizes things instantly, someone who can also say, look, you are such an ethical person where I can see you're doing all you can. Here's an avenue, here's another avenue, and coach you through it. It's incredibly rewarding. So the struggles were very much self-confidence, and then I pushed through that knowing I could help others, and then thinking, well, I'm doing it for them, and in the process, I guess I'm getting the benefit of knowing I'm helping.
Yeah. Well, I mean, look, hey, I think as clinicians, sometimes it's quite difficult to feel weak or show vulnerability. Sometimes it's, these ordeals don't just resolve over a phone call or a chat. Sometimes they drag on and on longer than you would like, How do we, maybe as a caller, navigate through that?
The key thing is remembering it's about keeping that person. If you're dealing with, say, a difficult patient and there's been threats, there's that kind of situation, you have to remember it is all about that person and what they are feeling. It's not about how you are feeling. If you can remember good communication where it's how can I help you or help the situation to get to that point, what do you need? What is it? You know what I mean? You're honing in on that person's needs. And if that person can tell that you are trying to help them, that you're trying to satisfy their needs, they will naturally be in a, let's call it a safer modality, a safer headspace. They're not in that fight, flight, state, stress state where it's like push back. They're accepting, they believe, they still trust you. It's about keeping that good rapport, and then you can communicate. Don't get me wrong, Laurence, there are some patients and people, staff members, whoever you're having challenges with, that you have to get to a point where you know you're not going to get through to them, and you have to protect yourself. So notes, everyone write heaps and heaps of notes all the time. It is a bit mundane at times, but it is really, really good to know you've got that backup of all your notes. And because if you get into a bit of hot water with the legal system, at least you've got that to fall back on. And threads, email threads are great as well. So once you've got that person to a lovely headspace and they know that you are just trying to resolve the issue, that you are not trying to be hostile or defensive or diminish their needs, then you can start your negotiation process. Always protecting yourself. Talk to your insurer if you're worried, or, you know, a panel member, or other senior dentists who've been through it. It's really, get your support team around you, your cheerleaders, and keep your eye on the prize, what you're trying to achieve here. You might say, I just don't want that person ever again. So you find a way to, what's the word I'm after? It's amiable, to find an amiable way to move them out of the practice and move forward yourself and let it go, because it doesn't mean you have lost anything. You're not a lesser person. You're not a lesser practitioner. You've just had a big learning experience. Yeah. I think the word, are you looking for amicable? Is that what the word it was? Amicable and with an amiable relationship.
Okay, fair enough.
Yeah. Meaning, like, still, I know amicable, good friends. I think I got that amiable word from, I was watching one of those shows on the Royals, and when you had one of the kings abdicate. Yes, and Mrs. Simpson apparently wrote in her letters, I had an amiable relationship with my ex-husband. Go figure. Amiable, amicable, both good. Tomato.
No, it's all good. It is all good. So, but you've actually gone on and created a platform to help colleagues deal with these challenges outside of it as well. And it's called Smile Chicks. Tell us about that and what kind of struggles you had experienced.
So Smile Chicks was born through friends out socializing. Let's create an Instagram page, and that's how that began. And then when I began some marketing campaigns, when I joined the two practices together, one of the marketing fellows actually said to me, "Have you thought about making Smile Chicks into a brand?" And I hadn't really. It was just my personal platform, bit of fun. So we ended up making it a brand because I realized that was a great platform where I could actually reach out to my colleagues and say, hey, I'm here if you want to chat. We had some laughs over just general dental things. It wasn't as serious as DPR, which is great, wonderful platform, but just not what a lot of us sort of really wanted. And I also then sort of made Smile Chicks like the umbrella for branching out. So I had a couple of dental practices. I was establishing a bit more of a beauty line, which was to do with the injectables, and also mentoring programs. So just before 2020 was all set up to do some masterclasses and, you know, really start to help dentists negotiate their way business-wise and CPD, and also ignite that enthusiasm. Keep everybody going. You know, I'm very passionate about that. So challenges personally would be I got caught up a little bit in FOMO. I certainly got a bit caught up with the validation that Instagram kind of innately gives you, but isn't real. That false validation. Yeah. So, you know, it's a funny thing, the hormone system and how the dopamine release kicks in, and we can all get quite addicted at times. And if you can step back and go, I can see what's going on here. I'm clearly getting a bit addicted. I'm clearly trying to get some sort of false validation from Instagram or any platform like that. That's when you're in a really good position to grow and learn and make wiser choices. So that was a bit of a challenge for me. I worked it out. I'm very happy to say now I just use it for all the good I can think of. I get a lot of good feedback from people saying, I needed to hear that particular thing you said today. I don't lie there thinking, what am I going to post? What am I going to do? I did at one point, I won't lie. It was a lot of pressure. Didn't need any more pressure. I was already a mum, a wife, a businesswoman. I was like, and that's when I went, okay, I've got that feeling it's not safe. It's not going to be quality delivery. So I removed myself, and now I will post things that come through which I feel are relevant at the time. They're words that I guess just come to me. I apply them to myself. It's not something and if I see a really good post from someone else, I love sharing it on my story and just saying, hey, this is a great post. And I guess it gives the kudos to the person who put the post up in the first place. So if we can all keep celebrating each other rather than knocking each other down, I think that's really important too.
Yeah.
I have to say, carry on.
I was going to say, talking about knocks, you've mentioned that you've had some hard knocks and mistakes that you made in your industrious career at one point. You even mentioned naiveties and others' intentions was something that you've mentioned in the past. Can you tell us more about that?
Yes. Gosh, you have done your research. So I really feel that you can look for the good in people, and I tend to be one of those people who does it. It's sometimes you need to just do a bit of a reality check and look at what those people are actually presenting you with. And you might really want to like someone and like their ideas and like their proposals and support them, but it's essential that you are realistic about things. And I've learnt the hard way. I have no regrets on the level that I've supported someone and done the best I could. But in the end, if you are losing money and your ROI is right down, you're not getting what you have been promised or what you even expected, there comes a point where you have to say, that's enough. You have to draw the line. It's your point of no return where you go, okay, done, and not beat yourself up about it. That's something I used to do. I used to beat myself up and go, how could I have been so stupid? But in the end, you learn so much. And it's that have to experience it to really hit home what you should do. So my advice is just to, again, due diligence. Yes, see someone, their enthusiasm, admire it. Just be realistic about what they are offering and don't get too involved in a startup where you might be a guinea pig. And you might lose out, and you could even go. I did have a time where I lost quite a lot of patients through an email marketing scheme that came through. And I fortunately I pulled the pin quite early, but I saw there was a lot of damage being done. So awareness, if it's your business, keep aware. Always just have that helicopter without being a helicopter mum.
Yeah. So you're saying that kind of came about because you wouldn't have known, because you're in it. I mean, how would you have seen it from the outside? Was it because someone mentioned it to you from the outside, or? I
looked at figures. I looked at numbers, tracking. It's really important. And I also, yes, there was some feedback, and front desk people. If they can tell you, I mean, sometimes you don't want to hear it. It depends. If you allocate a time in the week where you say, this is my feedback time, give it to me, good or bad. You know what I mean? Constructive is, you don't say bad, constructive feedback. It really works well, because sometimes you can't have that feedback. And patients were sort of saying, oh, these emails are a bit confronting, as an example. And I saw some loss. I saw requests for records from other practices.
Yes. And
you have to click down. It's important that you contact those patients and just sort of say, look, happy to help you wherever we can. Just checking in on, can you give me some honest feedback, why you're having to leave the practice. And so that's what I did. You can't be scared of a rejection. You have to again embrace it and say, right, now what can I do to be better? There is time. That's another thing. It doesn't all have to be done and fixed tomorrow. Just pace, take your time, and keep in tune with your patients and your staff. You don't have to micromanage, just keep in tune with them.
Yeah, I guess most people don't like to be held by a leash, right?
Exactly. Got to give everyone some autonomy. So if you can allocate a time to have some good constructive feedback so everyone's in the right mindset, I think that's really invaluable.
Fair enough, yeah. I mean, can you talk about a time when you were working, was it between two states at one point?
Yes. That was a wonderful time in my life. I was introduced to Kia Paget through another really good friend who's also a serial entrepreneur. And Kia, he really inspired me. So he's the owner of Smile Solutions. And he was looking for an injectables person literally that day when he was doing a seminar in Brisbane. He'd been talking about it with his practice general manager. And I was introduced to him. We clicked. He was such a motivating person, and he just basically said, come down to Melbourne. I want you to see my practice, which you probably know, Smile Solutions is pretty phenomenal. The building and what he has achieved was, amazing. So what I did was I jumped on board with Smile Solutions as their cosmetics person, their facial injector. I went down every fortnight to begin with, and I'd have one night overnight, and I would work 2 full days. Met the most amazing people, practitioners and patients, got to just do full-on injectables and actually start up a proper regime for the injectables. Call it a tier, the tier of Smile Solutions. That was amazing. It was good. Just even, taking a medical history specific to facial injectables and making it, rebranding it to fit in with the ethos of Smile Solutions. Little things like that. All the staff came and saw me, so that was great. They all got fully on board, and we had a lot of fun as well. In the meantime, I was still trying to run a practice in Brisbane, and that became quite a challenge for me because I was getting very tired, and it was also taking away a little bit of that quality time with family. My children, teenagers, were very understanding and saying, okay, well, mum's away that night. But it was when I came back and I was super tired that it was a little bit of a struggle. Having said that, I learned a lot. I gained a lot. I ended up working at limits. So that's another thing I've always gone, right, if you work at your limits, then bring that into everything with your functioning. What's your limit for working on, your clinical work? What's your limit for the number of days you can work and sustain the enthusiasm for dentistry and not take it out on your patients? What's the limit for your energy levels? And I ended up doing every 3rd week for a while in the 2nd year just to space it out. They were always very accommodating, and wow, the great Instagram photos I got. Oh, this building was incredible. And being in Melbourne, I miss Melbourne. I can't wait for Melbourne to come back on board, back on deck. And at the business, I did have to get to I actually had some family reasons. That's why I ended up finishing up there, and also that was just before COVID hit. So I guess the timing was good for me on that level. It would have been very difficult. But coming back to the business, I had a great team who also appreciated that I was trying to do something that was at the forefront of dentistry and set it up and inspire others and still bring in. Obviously, you have to still look at the bottom line. So I had to make sure I was covering my bottom line as the business owner. So I hope that answers your question. It wasn't a very exciting time, but it was challenging. It wasn't all good. It was certainly challenging too.
Yeah, I think it's an interesting aspect, not a lot of people do that. And, if people are thinking about it, like you've mentioned, those are the key points to consider. Yes. So who else has been pivotal in your career path and why?
Well, I would definitely say the DSD combination with Christian Coachman and Tony and Fadi Yasmin. These guys, they've been pivotal. Oh, sorry, I'm just going to decline it. Yes, I'll be coming right back. I'll just decline this call. I thought I had my do not disturb on, but yes. That's actually my best dentist friend ringing. She's probably ringing to have a gripe about something.
You'll have to invite her on in the future.
I will. She's hilarious. She keeps everybody laughing as well. And that's another thing, is it's important to have your friends who you can have a bit of a whinge to. You never whinge downwards. You always whinge crossways or up.
I'm not quite sure I follow.
That means you don't whinge to your dental assistants. You don't whinge to your staff. You whinge to other people who are on the same level as you, or and friends who understand, or you whinge up to your employer or someone who's senior to you. And that is another thing I've learned over the years, because people need to feel safe when you're in such a responsible role. As the practitioner, you're looking after the patients, you're looking after staff, you are running the show. People need to feel safe. So you've got to have a whinge, make sure it goes to the right place.
I'll keep that in mind.
Okay.
Who has been pivotal in your career path?
Pivotal. So yes, back to DSD. So the reason it was pivotal was because it, as I said before, it taught me how patients see things with the photography, and how you can really give them an insight to the end goal by using photography, by using the technology of smile design and collating that to fit in with the lips, all the soft tissue, and sort of, I guess, we have to be salesmen at some point, don't we? But as long as it's an ethical sale, where it's going to be for the benefit of that patient. So by being able to administer a smile design and show people what is achievable, then explain to them, yes, they might need a gum lift, they might need orthodontics, but if they keep their eye on the prize, you'll hold their hand through the whole process and deliver this smile. It's such a rewarding journey. And so that has been pivotal for me. I've obtained some great cases just from doing an Instagram post on my business Instagram page of the sliding scale. You would have seen that, where you slide from your existing smile to what you can be achieved through DSD. So that was pivotal for me. I've so enjoyed that. All my bosses, though, Laura, they've been fantastic. I've also learned some things I don't want to employ as a business owner, but on the whole, each one has delivered some absolute gold to me. So it's not on that big scale. It's very much in-house, at the clinic, one-on-one, over a coffee. Really significant. You can obtain some amazing information from your colleagues. Don't forget about them. And the competition's healthy. Don't think that you've got to walk away from a little bit of a competitive thing, going, okay, I'm going to make myself better.
I mean, even the best, dental practice communicators or consultants or trainers have people that, they go to help them. Who's that been for you?
There's been quite a few over 25 years, as you can imagine. Currently, I actually obtain a lot of gold from my associate, Dr Nick Sheptooha, whose practice I bought. And he has been in the industry a long time. Very experienced, has tried lots of different things. He's always tried to be at the forefront of dentistry, and he's also been a big go-to for Queensland dentists to talk about full mouth reconstruction and things like that. So I have to say, Nick, amazing. And he's very non-judgmental as well. If you can find someone who's easy to talk to, they deliver good information in a very happy way, not in a critical way, hang on to them. So he's been amazing. Just trying to think who else. Look, Matthew Volts, who's a Max Fax in Brisbane, has been amazing for me. He probably wouldn't even know that. He probably won't even see this. But he, even from when I was at uni, and I remember doing a SUP for one exam, one practical exam, and I learnt more in that SUP than I did the whole semester of the course, the subject. My first two bosses, the two women, Trish Rimmer and Leo Vasquez in Cairns, taught me more in that first 6 months of being a new grad than I learnt the whole 5 years of university. So if you can find those people, yes, they will stay pivotal. I love that's a great word. Pivotal in your mind for your CPD journey and creating who you have become today.
When a lot of graduates, they want to be social media influencers, but, you're like the original social media influencer, because you've presented on radio, on ABC, you've been on TV, 7, 9, 10, what would you say to all these colleagues?
Oh, thanks, Laurence. That sounds great. I would say just remember it's about lifting the profession. It isn't just about you. It's about what you can offer others. And it's one of my favorite sayings is that all boats rise with the tide. So if we can share knowledge and help each other, then and put other people up there, celebrate others' achievements. It really is important. So if you can celebrate another colleague, one wonderful dentist you might have heard of, Dr. Sam Coe. He is amazing, and I've known Sam since he was quite young and did some injectables, and he has just it's been amazing to watch him flourish and become a leader in the industry. So and you yourself, as I said before, I just really admire what you're doing to help educate, help inspire, help create this strong cohort so we can all thrive and grow together for the profession. Another thing I would say is just to remember to be humble. Okay, celebrate your wins by all means, but be humble, because dentistry is an ever-changing profession and it is a privilege to be a dentist. Mustn't underestimate that. When you do your social media, have fun. When you're talking to people, when you're doing your posts, just have fun and think about what your audience can get out of it. Not about your performance or what you're doing. Think about what they can get from what you're doing. And I think if you have those things in mind, have fun with it, enjoy the beauty, because we are all artists. We do love the aesthetics. Enjoy the beauty of Instagram and any platform that you engage in, then you will be fine.
Well, Dr. Kristina Cain, there's so many more questions I want to ask you, but that's all the time we have for today. If you could let the people know how they can find you or what's kind of going on in your life.
Sure. Well, thanks again, Laurence, for having me. It has been wonderful just chatting with you. I would say the best way to reach out to me is on my Smile Chicks platform, Instagram. And if you want to send me a DM, that's great. I'm also on Facebook, of course, so Messenger, easy. I'm at Refresh Dental Spa, so that's in Brisbane. You can contact me that way as well. Currently, I am forging ahead with my CEREC and learning, and my next big move is 2 floors up in my building where I'm doing my first brand new fit out. Wow. And that's coming in the next 4 months. Very excited, looking forward to a brand new modern facility and being able to offer that wonderful new modern aspect and enjoy the creation myself. So that's my gig at the moment.
Well, as you say, measure twice, cut once.
Yes, I do. Thanks, Laurence. You're amazing.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Thanks, Lauren.